We now have Dr. Bindiya C. Presenting her case about transition to sub-tenon anesthesia in cataract surgery has block-related complications reduced.
So today my presentation is about transition to sub-tenon anesthesia in cataract surgery, whether the block-related complication has reduced. So peribulbar anesthesia is the most popular technique used in cataract surgery. It is not completely free from complications. Sub-tenon anesthesia involves infiltration of local anesthetic agent directly into the subtenon space after instillation of local anesthetic drop in the conjunctiva, which takes away the pain from the needle prick. It is usually given in the infero-nasal quadrant. Material and methods. Inclusion criteria was patients whose cataract surgery was done under peribulbar or subtenon anesthesia. Duration from May 2013 to April 2016, it was peribulbar anesthesia, and then there was a transition, that is from May 2016 to April 2019, it was subtenon anesthesia, and the total duration of the study is 6 years. Study design is a retrospective study analyzing complication rate between peribulbar and subtenon anesthesia, and data was obtained from hospital medical record. Coming to the results, 98,200 surgeries were done under peribulbar anesthesia during pre-transition period, and 116,144 cataract surgeries were done under subtenon anesthesia during the post-transition period. So the outcomes taken into comparison were globe perforation, chemosis, subconjunctival hemorrhage, number of repeat blocks, and positive pressure. So we used the proportion test to analyze the results, and it was found that perforation rate was almost like 0 in case of subtenon anesthesia compared to peribulbar anesthesia. But there is significant rise of non-serious complications like chemosis, subconjunctival hemorrhage, number of repeats, and positive pressure in case of subtenon anesthesia. So coming to the discussion, majority of the subconjunctival hemorrhage which was in subtenon anesthesia is confined to one quadrant, and it can be prevented by careful dissection of the conjunctiva. It will resolve in 7 to 14 days. Chemosis occurs when anesthetic solution is spread into anterior subtenon space, causing ballooning of conjunctiva. So it can be prevented by introducing anesthetic solution in posterior subtenon space and applying digital pressure for 3 to 5 minutes. It will resolve in about 24 to 36 hours. Globe perforation is the most sight-threatening complication. It has a poor prognosis and there can be need of additional surgeries. So there was a similar study done by Parikshit et al, and it was found that subtenon anesthesia is safe and as effective as peribulbar anesthesia and is more comfortable to the patient at the time of administration. So limitation of the study is definitely it has a less sample size. So coming to the conclusion, in case of subtenon anesthesia, there is almost nil risk of globe perforation. There is a short learning curve. It is less painful for the patients. It is not a blind procedure, and there is avoidance of sharp needle. So thus we conclude that subtenon anesthesia is as effective as peribulbar anesthesia. Thank you. These are my references. Thank you.
Your title is block related complications have they reduced, and now you are saying the conclusion is it is safe.
Sir, it is like non-serious complications, it has increased in case of subtenons like chemosis, all those subconjunctival hemorrhage and all. But we are more concerned about the serious complications like globe perforation. So I think considering that, definitely subtenon anesthesia is better.
You had tested 98,000 patients in 6 years. It was not given by a single person.
Yes.
So can that vary, and will vary the result?
Yes, sir. Definitely based on, because some blocks will be given by residents. So based on the persons who give the block, definitely it can vary and there is a bias.
And why are you telling it is less sample size?
98,000.
Sir, considering all these bias, I consider it little less.
You want more?
Basically duration was 6 years, so I think we could have taken it.
It's a huge task to analyze so many patients. But did you really have details of those who have given the injections?
Sorry, sir. That exactly we had details, but actually I didn't involve it in the study as a parameter.
That was most important. Like sir said, your title could have been better. Another thing is, what about the quantity of drug given in peribulbar block and the subtenons? Even that should matter a lot.
Usually in our institution in subtenons anesthesia we are giving like 3 ml, but in peribulbar anesthesia it can go up to 5 ml, ma'am.
So even that was not mentioned.
Which type
Yes.
of cataract surgery was done?
Ma'am?
Which type of cataract surgery was done?
Mainly it is a small incision cataract surgery, sir.
Have you